thank you so much to Centerstone for their partnership and the expertise that they'll be sharing for the benefit of us all. We also give recognition to AllTrust. AllTrust stepped forward immediately to offer sponsorship support to make the webinar series available. Steve Hall, thank you so much. Steve is a member of the Manatee Chamber's Board of Directors, and we appreciate AllTrust support as well as Steve's. I am really eager to hear the presentation today, knowing that as leaders, we have been asked to pivot in so many ways to support our business, as well as the well-being of our teams and the well-being of our families and our neighbors, quite frankly. So with that, Erica, I'll turn it back over to you for the rest of the announcements before we get ready to hear from Jessica with Centerstone.
Now I'd like to introduce Jessica Kruger. Jessica obtained a master's degree in social work from the University of South Florida and has 7 years experience providing substance abuse and mental health counseling in Manatee County. As a supervisor of Centerstone's prevention and intervention programs, Jessica oversees the provision of a variety of grant-funded psychoeducational services for youth and adults in the community. She also serves on the Board of Trustees for Drug Free Manatee. Welcome, Jessica.
So COVID-19 has dramatically shifted our personal and professional routines in an unprecedented fashion. Over the course of a few weeks, organizations across every sector have had to completely restructure the way that they do business. The sense of uncertainty surrounding our personal, professional, and economic situations has led to significant increases in levels of stress, anxiety, and isolation being reported. For those of us in leadership roles, the task of managing our teams and businesses under these pressurized conditions can feel especially overwhelming. Effectively managing your mental health during this crisis is imperative if you want to maintain the ability to think critically and make the best decisions for yourselves, your families, and your businesses. When I was developing this presentation, I decided to reach out to some local professionals to get a sense of what their experiences have been here locally. I got a chance to speak with some residents currently working in education, finance, healthcare, real estate, as well as some small business owners. Pretty much everyone I spoke to mentioned an increased sense of instability, concern about lost revenue, concerns about the health and safety of their families, difficulties adjusting to remote work, and challenges with balancing their responsibilities with the needs of their children who are now all homeschooled. While everyone's situations and personal challenges were unique, I did recognize a common theme with a lot of the sources of stress and anxiety that everyone was describing. Everyone really seemed to be struggling with a daunting general sense of uncertainty about the future. In an effort to share information about strategies for managing our mental health in a way that would be relevant and helpful to the greatest number of people, I decided to focus on strategies aimed at training our brains to be more tolerant of uncertainty. So our brains are hardwired to operate as prediction machines. Our thoughts and feelings and behaviors are formed around the educated guesses that our brains make about what will happen next in a given situation. Our brains are structured this way to help us recognize danger and stay safe. When things become especially unpredictable, our brains struggle to predict and prepare for outcomes, which can create a lot of emotional discomfort. In response to this discomfort, our brains will even begin to create stories to fill in the information gaps, and it can be hard to differentiate between these stories and hard facts in times of great stress. A lot of the times, the stories that our brains have created to comfort us only end up making us feel worse. A common response to these type of stressful situations is to engage in the act of worrying. Worrying involves ruminating over an imagined scenario or possible outcome over and over in our head. Our brain views the act of worrying as a protective strategy for preparing for real future events. The more we allow our brain to unconsciously respond to uncertainty in this way, the more deeply we enforce the habit, and it becomes easier and easier for us to catastrophize, often without even realizing we're doing it. When we repeatedly engage in these maladaptive responses to uncertainty, the brain networks responsible for threat assessment are being repeatedly activated, triggering our physiological stress response system over and over again. Staying in this heightened fight or flight state for an extended period of time will begin to take a toll on our mental and physical health. This type of stress can begin to narrow our perspective and impact our ability to critically think, ultimately making us more likely to engage in fear-based decision-making, which often doesn't have positive outcomes in the long term. So this pandemic has really highlighted the need to develop a greater tolerance to uncertainty as a society, which can sound overwhelming. The good news is the tolerance to uncertainty is like a muscle and it can be strengthened. Repeated engagement in healthy coping behaviors is the key to building resilience and decreasing that discomfort we feel when we're dealing with a great amount of uncertainty. So a good place to start when we're trying to build these resiliency skills is to look at our feelings. Be honest with yourself about what you're feeling right now. There's a lot of research to suggest that labeling your feelings can reduce their intensity. Whatever you're experiencing is okay. Acknowledge the feelings and don't fight them. Don't judge yourself. Just recognize that that feeling is present, that it will peak and it will subside. It's temporary. The sooner you're able to feel your feelings, the faster you're going to be able to discharge them from your system. And then you'll be able to go back to focusing more effectively on your business and survival. We want to pay attention to our automatic thoughts and self-talk right now. Our words have power, whether we say them out loud or in our head. And it's very easy, especially in times of great stress, to engage in a really negative dialogue and start verbalizing those catastrophic thoughts and concerns we have about things. It's really hard to stay positive and stay in a logical headspace when we let that unconscious behavior get too far out of control. It's also really important to balance our emotions with logic right now. The goal in doing that is not so much to convince ourselves that everything is perfect when we know it's not. But if we're having a lot of negative thoughts or catastrophic predictions about things, we need to remind ourselves that just because we're thinking it doesn't mean that it is destined to happen. Use some reality testing to help you sort of determine whether it's something that you know as a solid fact or whether it's something that your brain has created to prepare you for what it's interpreting as the worst possible outcome. Another important strategy is to focus on what you can control right now. There's so many things that we have no power over at this time. So even if it's something small, pay attention to that. If it's your interactions, your schedule, your self-care routine, really stay in that moment and be aware of opportunities to compartmentalize your thinking. Create a routine for social time, for work, for self-care, and stick to it. I know we've all heard create a routine as a strategy for this a lot of times at this point, but it really is incredibly valuable, not only for you, but for your family and for our kids right now who have had their day-to-day routine completely uprooted. There can be a lot of comfort in establishing that and sticking to it. And then decide if you're going to work from a certain period to another and you're working remotely. Worry about the things you have to worry about for work only during that time frame. And when that time frame ends and it's time to transition into family time or self-care, stop thinking about those things. We also want to shift our attention to our short-term goals right now. When we started 2020, we probably had a lot of long-term goals and things that we wanted to accomplish over the next 12 months or maybe the next few years. With everything being so uncertain right now, focusing on what's shifted or changed or what we've lost control over in regards to those long-term goals can feel really overwhelming, defeating, and make us feel hopeless or helpless. That's not helpful to us right now. So pay attention to what our short-term goals were and look at the ones that are still obtainable. Shift those expectations based on what the circumstances are for you, and then start working on that. Finding ways to stay physically active is the one that usually gets the most eye rolls from everybody, just because it's the last thing that most of us want to do when we're experiencing a lot of stress and emotional discomfort. But it truly is one of the most valuable ones. It doesn't have to mean that we go for a 10-mile run every day. It could just mean that you take a walk around your neighborhood, you get up and you go and, play with your kids in the backyard. Just making sure that we get out of that chair, we get out from in front of the TV, and we go do something. We want to make sure that we're maintaining our social engagement. It can be really easy to isolate right now when we're in a quarantine or we're experiencing a stay-home order, just because the normal structures that we had to have social engagements are shifted right now. So make sure that we're setting up those Zoom calls to check in on friends and family, that we are reaching out to other people. Make sure that you're talking to people socially every single day. A lot of people have told me that they've noticed that they are communicating with their friends and family on a much more regular basis right now because they are intentionally scheduling it for themselves. And they've reported that that's really been effective in helping them create a sense of normalcy and feel connected, even though they're not seeing people nearly as much as they were prior to all of this happening. We also want to be really mindful of the quantity and quality of media that we're ingesting right now. There's so much on the news. A lot of it is negative, and it's very easy to turn the news on and keep it running all day long in the background. That's not recommended by anybody right now. If you want to get on and pick a reliable news source that you feel is trustworthy and get your update, in the morning and in the evening, pick an amount of time that you're going to engage in it and then stick to it and turn it off after that. And then we also want to be mindful of how long we're spending on social media right now. It can be very easy when we've lost the structure to spend triple the amount of time, on Facebook or on Instagram doing things like that. But if that's not a part of the routine and the daily schedule we've set up for ourselves, that can also sort of increase that disassociative feeling that we're all going through right now with the uprooting of our schedules and our normal day-to-day. It's also really beneficial right now to look for opportunities to help others. When we're experiencing hardships and we're struggling, mentally and emotionally, there can be a lot of comfort to be found in stepping outside of ourselves and looking around us and seeing, whether it's in a large way or a small way, how we can help somebody around us. So maybe it's a family member, maybe it's a stranger, somebody in the neighborhood. Whether it's donating financially or getting groceries for somebody, visiting or calling someone. So a lot of different ways that we can help. But there's a lot of emotional benefit to engaging in that sense of community right now. We also want to make sure that we're utilizing available resources. Don't be reluctant to reach out right now. Everybody is going through the same challenging time. And in the same way that it's helpful for us to be positive and assist other people right now, no one's going to feel like a burden. If you need something, or if you're, looking for an opportunity to collaborate, or you're wanting some input from someone, everybody is working from home or at their offices or more isolated than they normally would be right now. And they, would have their day made by the opportunity to connect with you and assist you. So one of the sayings that I'm often saying to people here is that you can't pour from an empty glass. We have to really focus on taking care of ourselves and making sure that our mental health and wellness is being maintained. And once you are taking care of yourself, modeling these healthy coping behaviors as a leader is really going to enhance your ability to support your team and cultivate organizational sustainability. When you are interacting with customers, clients, your teams, be compassionate, honest, and open in your communications. A lot of our employees are experiencing a lot of uncertainty right now about things. There's a lot of things that we can't promise to them, but we can let them know that we will keep them in the loop in real time as we know things. And we can let them know that we're going to do our best for them. We can promise that. Maintaining consistent formal and informal contact with our employees who are working remotely is also incredibly important to maintaining engagement right now. A lot of people don't realize that, but so much of our informal social interactions occur in our work setting, whether it's with customers or whether it's with our coworkers. And that loss is really impacting people's sense of isolation right now. So even if it's scheduling a meeting every day where everybody gets on Zoom or a call every day, and then maybe a time once a week where there's something more informal where everybody can just get together and catch up on what's going well, what they're struggling with, what they've been doing, how their families are, it can have a huge impact on keeping them focused and productive with what they're working on. We also want to make sure that we're demonstrating supportive listening skills when we're interacting with our customers and our employees. It's very easy when we're overwhelmed to step outside of the present and maybe not listen to them as intently as we'd like to. It's important to really focus on staying in the present and hearing their message, hearing what they're saying. We also want to maintain a growth mindset when we're addressing challenges. So when we're faced with a new obstacle, which is, on a weekly, if not daily basis right now for most of us, instead of focusing on all the ways that it's going to be hard, all the reasons why it's going to be difficult and what we're not liking about what we're facing, look at what is going to be interesting about it, what's going to go well, what can we develop as a tool. I know with us, we discussed telehealth options for a long time, and we ended up rolling it out and running with it within 2 weeks on a huge scale, just because we had to. And even though it's been stressful, a lot of my employees have given me the feedback that they now know that this is a tool that they have when the pandemic ends that they can utilize. We also want to make sure we're regularly reviewing all of our available resources with all of our staff, and remind your family and your loved ones and customers, whoever you're interacting with, about ways they can get support. So all of our experiences with COVID-19 are different. We're not all in the same boat. We're all facing different challenges, but it's really important to remember that we are all weathering the same storm and nobody is in this alone.
Jessica, I have a question for you. You had mentioned that the stress of what our environment is like now can result in physical symptoms. Mm-hmm. Could you kind of elaborate on that and let us know what to look out for or what stress could cause physically to our bodies?
Right. A lot of times that might be a loss of appetite. It might be difficulty sleeping, increased irritability, an inability to focus. Those are a lot of the main ones that you want to look out for. Those are kind of those baseline physiological symptoms that you're going to start to see. And using that, sometimes we're not aware if we're having emotional difficulties because maybe it's not the way that we normally think about things. But if you're seeing a shift in behavior, or if loved ones are saying that there's a shift in behavior that they're seeing in you, I think it's worth taking some time to reflect introspectively and assess what's going on internally.
And Jessica, another question here. Is the type of stress that people are experiencing now and how people are handling it at all or in any way similar to your experience with your patients at Centerstone?
Yeah, I think that, and for a lot of people, this is kind of manifesting as trauma, and that's very subjective. However, something influences us where it causes a great amount of stress is the same thing that we would see with our clients. And there's a lot of research that's already been done and treatment resources available for anybody who's going through this. What are some acceptable ways to ask a team member who you suspect is struggling emotionally, how they're doing, and how you can help? I think that being direct is really good. That's a strategy that we use here on my team. It's just saying, how are you doing? And if they only give you an answer about how they're doing with their work, say, okay, how are you doing outside of that? We're all, dealing with a lot right now. And sometimes just a little bit of self-disclosure can be helpful. If you're suspecting something with them, sharing, that you're really stressed and, you're having a hard time, say how you're feeling. Don't be afraid to be vulnerable with your team right now. I think that is, you're going to be the person that they're going to be most likely to be comfortable sharing with. And it's such a good leadership skill to model for them.
Jessica, we have a couple questions in the Q&A feature. We have a question here. Outside of resources available within a business's benefits, what community resources, including Centerstone's, are available for the public? And I believe Centerstone's resources you do have available at the end of the Q&A session. Is that correct?
Yes.
Okay. And also, do you have any tips about how to better support parents with children at home?
Yes, that's something that we've really been trying to focus on, and we've been collaborating with the district on right now. We have set up some open virtual support groups for students and for parents who want to get together and share what challenges they're facing, so that we have outreach staff that can connect them with the appropriate resources, whether it's technical issues that their kids are having with the virtual platform, or whether it's issues getting extra assistance with the schoolwork. Maintaining a schedule is really important, and adapting. We have worked with a lot of families that have set up an initial schedule for how their kids were going to do the virtual learning, and then found that something was off. So maybe they needed to adjust the location that the kids were working in, their proximity to their siblings while they were working, their ability to navigate to other websites during the time frame they're supposed to be working on school. A lot of communication and follow-up is important right now, especially our younger kids. They are developmentally not at an age where they're going to be very likely to be self-motivated to complete the quantity of work that they might have been assigned. And some of them are struggling to reorganize it all and complete it in an independent fashion. So following up with them every single day about what they did complete and anything that they struggled with, I think is really important to catching any problems they're having before, it's become further and further behind and more difficult to fix.
Jessica, another question here. Do you have any suggestions on best practices with employee communications? For example, the daily check-ins, etc. Any best practices for those?
We've been focusing on kind of maintaining an agenda. So normally we start off with something that has a little bit more levity to it. So maybe asking them one good thing that they watched on TV this week, one thing that was going really well for them, something funny that happened recently, and doing round robin, making sure that everybody has their camera on or is unmuted, whatever format it is, to get everybody engaged in the conversation and make sure it isn't just one or two people participating in a daily check-in, and make sure you're providing them with updates. It's also recommended right now that even if you don't have any updates, that you do still keep that meeting or that scheduled time to connect with them and let them know you don't have any updates, just so that you can provide a little bit more structure and consistency for people who are feeling isolated right now.
Regarding the question, as people prepare to re-enter the workplace, is there anything an employer should offer to make the transition easier?
I think that the answer is probably somewhat subjective based on what type of organization it is. But I think that a lot of communication about what it's going to look like when they come back, if it can be organized in a way that is gradual, just so it's a little bit less of a shock to the system to go from home in pajamas for 4 to 6 weeks to being back in our business clothes and in the office around everybody. Making sure that we ask them what they need and what they're experiencing as they transition back in. I think maintaining that communication and that open line, and then actively assessing the expectations for how things are going, and adjusting accordingly. It's really a time where it's important that we're very proactive versus reactive in terms of how we are planning things like this.
Any other questions? Looks like we've got one more that came in, 2 more. Do you have any tips about how to support our recently unemployed community? And so my guess is that often for each of us individually may apply to family members or friends, or to or former members of our own teams. Any tips on emotional support, well-being support for those that have been unemployed?
I think that it's good to try to connect them with as many of the resources that we have in terms of financial resources or emotional support for them, because that can be a traumatic experience to lose their job, especially in such a difficult time. Maintaining communication if they're placed on furlough or there's going to be an opportunity for them to come back, letting them know about that and checking in with them regularly, and being compassionate. This is something that's out of our control, and a lot of people have expressed a sense of guilt if they had to let employees go or cut hours. And we have to assign blame appropriately. There's so much of this that is out of our control, and it isn't our fault. All we can do is be kind, be conscientious, connect them with the resources, and stay connected with them during this time.
Thank you. And it looks like one additional has come in. And the question is, what would you highlight as the top 3 takeaways for leaders for managing their own well-being from what you so diligently prepared for us today? If you could sum it up in the top 3 takeaways for our own well-being, what might those be?
I think that it's really important to be introspective and self-aware right now, and take that extra time to not get caught up in the day-to-day and say, what am I feeling? What am I seeing within myself? How is my health right now? How are my interactions? Make sure that we're aware of whether we've gone too long without checking in with somebody or speaking to somebody. Making sure that we are disciplined and keeping ourselves on track. It's really easy to slip right now, and it's easy when we're stressed to engage in the more maladaptive coping strategies for these challenges. Making sure that you are holding yourself accountable and picking the healthy behaviors you want to engage in, scheduling them and sticking to it. And maybe setting up some accountability checks, assigning a family member at home or a friend to check in with and report to about what you did to maintain your self-care on a daily basis.
Thank you so much. With that, Jessica, I think you might have one more slide, and then Erica will wrap up with some announcements about what else is coming up in the rest of our series. Thank you.
All right. So Centerstone has stayed open. We are staffed. We have people at the office, and we've put in safety measures to ensure that anybody who has to come in for a service is going to be screened, and we're utilizing PPE and all the resources we can to make our on-site location safe. And we've also set up telehealth options to provide new client admissions and any of our other outpatient services for everybody during this time. In response to COVID-19, we also set up a care line. So anybody who is struggling and needs to talk, if they just want to learn about coping skills, find resources, feel supported, connect with somebody, that is a 24/7 line that is available to them at no cost. So we want to make sure that everybody knows that we're here, we're not closed, and we're not going anywhere. So anything that anybody needs, they can reach out to us, and we're here to go above and beyond and figure out how we can connect them with the resources.
So I'd like to thank Jessica and also Centerstone for the awesome presentation and your commitment to supporting our community. And thank you also to All Trust Insurance, our sponsor for the series. Well, thank you so much for attending today.